Good afternoon, everyone. Please join me in welcoming Lieutenant Governor David Zuckerman from Vermont, who is a candidate for the Vermont governorship, which we'll all be voting on next week. I'm Dr. Joe Paris. I'm the CEO and the Chief Medical Officer at Mount Ascutney Hospital and Health Center, which is one of the critical access hospitals under the Dartmouth-Hitchcock Health system. Lieutenant Governor Zuckerman, thank you so much for joining us today. Our health policy grand rounds are part of Dartmouth-Hitchcock Health's We Care, We Vote initiative. It's a nonpartisan voter education program designed to educate and empower our employees to participate in the electoral process, specifically by voting in the 2020 elections. All candidates that we invite are candidates for federal and statewide office. And all of these discussions are recorded and can be found on the Dartmouth-Hitchcock We Care, We Vote website. As I mentioned, today we'll hear from Lieutenant Governor David Zuckerman. Mr. Zuckerman has represented Vermonters for decades. He first served in the Vermont House of Representatives, then the Vermont Senate, and was elected Lieutenant Governor in 2016. David is the co-founder of Full Moon Farm, a Northeast Organic Farming Association certified organic farm in Heinsberg, Vermont, where he lives with his wife and daughter. An interesting note, the Northeast Organic Farming Association Vermont chapter has a great tagline that I may try to steal at some point: verdant, viable, and just. I think we can apply that within our healthcare system as well. So Mr. Zuckerman, thank you so much for being here. I'd like to turn it over to you for a few minutes for some opening remarks, and then we'll engage in some question and answers.
Well, great. Thank you, Dr. Paris. I appreciate the opportunity to be here, and all of you who are joining us today. I guess first thing I'm going to say is hospitals are not a foreign place to me, which some people might think, oh, what's my ailment? But actually, my dad was a cardiothoracic surgeon at Mount Auburn Hospital and taught at Harvard. My mom had a PhD in biochemistry, did some medical research back in the 60s on endocrinology work with women's reproductive health systems, and then went on to get a nursing degree in the early 80s. The term grand rounds and making rounds, I used to go with my dad to the hospital on Saturdays all the time to visit with his patients when I was a kid. And so I have a warm place for hospitals in my heart, which is probably not what you hear from most people, because they usually don't want to be in a hospital. You're usually there if you're sick. But I thank you all for the work you do, because of course you try to make it as positive an experience and as difficult a time as most people face. So yes, I am running for governor. I'm the current lieutenant governor, served in the House and Senate for a combined 18 years before these last 4 as lieutenant governor of Vermont. And as I pondered whether to run or not throughout the summer and fall last year, a couple of major factors came into play. And one is that I've always been a fairly active person in political office. Some serve to look out for their community and sort of monitor what's going on and vote yes or no. I've always been a bit more of an organizer and activist in government. I was very involved in the marriage equality laws in Vermont, GMO labeling, which those of you who are familiar with the Vermont law back in 2014, I started it in 1999, 15 years of work. Cannabis reform, end-of-life choices, which I think probably would be something that many folks are either stridently for or against, or maybe are okay with in your line of work. And those issues, raise the minimum wage, affordable housing, and climate issues. And as I thought about running last fall, the timeline on our climate situation has really just become so immediate that the idea of waiting for another 2 years, which some people felt would be the more politically astute thing to do, was not really an option, because I don't really believe in holding an office just to hold it. I believe in the good fortune of being in the office for a couple of years means you've been put there to do something to improve society. I know that a lot of issues around medicine are often talked about with respect to direct medical care and HIPAA and insurance, and so many other factors, education, debt, so forth. But when I think about our society I'm often thinking about how we have a very siloed approach to thinking. And you probably can't tell, but I'm actually sitting in a silo right now. I live in two converted silos that are now a house. Um, and hence the curved rail right there. I don't know. It's always funny doing things opposite. Um, and when I think about medicine and health, uh, I think about a lot of things combined. I think about housing. I think about food as an organic food producer and local food. I think about healthy food versus sort of the cheap food policy of our country since the 40s, which has led to many, many issues that you all deal with, from diabetes and other chronic issues that are sometimes genetic based, no doubt about it, but often are environmentally created through repeated exposure to various things, but our food is a big piece of it. Uh, so food and housing, I think, are deeply ingrained and related to the health situation of our society. I also am someone who is really um, never been comfortable with the idea that we have mental health and then we have physical health, and of course there is physical health in the head part of the body as well. But that's another piece of where we've really siloed our thinking and are not being holistic in how we approach things. So my approach in governance in general is much more holistic. I'd like to see us break down some of the barriers between different agencies in government, particularly human services and education, where in Vermont we have both serving many of the same kids. And I think there's a real disconnect in those two worlds where we could find both efficiencies and better outcomes by creating a better continuum of service of working with families and kids that are struggling. And many of those kids in those struggling families sometimes end up getting into, emergency rooms because they don't have primary care. So I've rambled a bit because there's so many different topics, of course. But I'd rather maybe turn it back to you, Doctor, and see where people want to go with the conversation. But I hope that was a broad encapsulation of
It was. You hit on a point toward the end of your comment around what do we do for struggling children, struggling families. At our hospital at Mount Scottney, we created a family wellness program and that has been very successful in providing coaching for families that are struggling. That said, there's no reimbursement model for that. So we go out and chase down grants. And thankfully, we've been successful in getting grants to sustain these programs a year at a time. What would you propose for more long-term sustainability of these programs, which are proven to be valuable, at least at our place?
Well, certainly. I mean, I'm not overly familiar with where those grants came from and whether it's federal or state monies, but to
Private.
go into a little more detail about my human services education world, which in Vermont, those two combined are 2/3 or more of state spending overall. And I had a press conference maybe a month and a half ago with a woman who had gotten, I think, divorced and had two kids and was struggling and went to human services to get various supports. And you've got housing support, food support, heat support, childcare support. You've got many, many different programs in human services to help folks get back on their feet. But you had to fill out separate applications for each one. So that to me felt very siloed. Why don't we have a more single port of entry to human services world in general, and then have the two or three different arenas meet with someone at once and work as a package system to help an individual get through their hard times, get solid footing under themselves to let them fledge back out into the broader society without necessarily having the need for the supports. And when I think about education, I think oftentimes those kids that are in that same situation are the ones that end up coming into school less prepared because the mom or the dual parent situation where they're working minimum wage jobs, they're working 60 hours a week and they're not reading to the kid and so forth. If we were to blend all of those, start getting rid of some of these silos, I think there's potentially savings there. And if there's financial savings there, then those resources could be available to keep investing in those other aspects of supports and expanding it into the healthcare arena for those kids. Uh, I am unabashedly a healthcare as a human right person. I very much believe that our system could use some pretty significant overhauling in terms of how we pay for it. I think the fee for service you mentioned is certainly maybe a piece of historical systems that we could maybe do better. Um, I know some people are concerned about maybe a, quote, socialized medicine or universal healthcare system of some sort. But I do sometimes wonder why so many dollars go to the insurance world and the insurance bureaucracies that could be spent providing care. And a lot of that could be primary care. And in Vermont, I'd like to see us have a universal primary care system, which may then cover some of what you're talking about, Doctor.
Um, that's another great launch point for another question. I've got one pending from our audience, but before we get to that, as you know, Vermont's been pretty aggressive in moving away from the fee-for-service world to value-based reimbursement healthcare delivery. We are 3 years into a 5-year project. My hospital and Dartmouth-Hitchcock have been very supportive of the program. In fact, Dartmouth-Hitchcock is one of the founders of the accountable care organization, One Care Vermont. But we are starting to think of, the all-payer model version 2.0. Where, if you are elected governor, how would you guide those discussions as we build toward further healthcare delivery reform in the state of Vermont, knowing that Dartmouth is the second largest provider of healthcare for Vermonters across the state?
Well, and my spouse had surgery there as well. So thank you for that care in the main facility in Lebanon.
Yeah.
Well, I have been critical of the ACO of late with respect to the resources that have gone into it relative to the so far unseen savings. And maybe that criticism is too quick or too brash, but at the same time, because I know it takes time to shift such a massive tanker, to use a seafaring metaphor. At the same time, when I think about if there was, 18, 15, $20 million a year the last 3 years invested in primary care, doctor, maybe student loan repayment, if you were to locate in rural parts of our state, how many providers could there be in primary care physicians throughout the state, which is a huge challenge, certainly in Vermont. I don't know about over in New Hampshire, but our rural areas are really have a dearth of primary care doctors. What if we put 20 million a year for the last 3 years into really building a robust primary care network all over the state? They may or may not be affiliated with hospitals. Some of them may be independent. I know that's a whole nother conversation that we could get into, because I happen to think that our independent docs are getting, remunerated in a much lower percentage pay scale from insurance companies than a lot of times the larger hospitals that have a better negotiating power with those insurance companies. So all of these things are things that I would want to be a part of those conversations. At the same time, I don't think it would be appropriate for me to guide them 100% because I'm not an expert in the field. One of the key aspects I would think of being governor of the state is to make sure to bring those with knowledge and expertise, and particularly knowledge and expertise and different opinions to the table to make sure we really hammer out and flesh out different possibilities. Because one thing I've found in Vermont, at least for the moment, is we have a governor that basically surrounds himself with people that all agree with him. And I don't think we get the best results when you have that situation. I think we get the best results when we bring a range of people to the table, certainly maybe with a direction. Mine would be towards a universal healthcare system, but at least with different voices to make sure you don't make unforced errors when the magnitude of those errors with a cost and it's 20% of our state's economy. You don't want unforced errors.
Yeah. So I'll read off a question from one of our audience members. Lieutenant Governor Zuckerman, you mentioned breaking down silos in the healthcare space. What are the biggest barriers to doing so? What steps would you take as governor to break these down?
Wow, I think probably the biggest barriers is everyone's nervousness about change, from state employees at the health, Agency of Human Services. I'm a strong union supporter, and I've often had, and I do have the endorsement of the Vermont State Employees Association and the NEA, the teachers. At the same time, one has to work with folks and say, okay, but now let's come down to the frontline workers and say, where is the system that you've been operating for 10, 20, 30 years? Where has it fallen behind with respect to either technology and information or how we provide the services? What have we learned? What do peer organizations across the country What have they experimented with and found success with that we could incorporate? But, I think it's really hard when you have frontline employees who are, they're making 40 or $50,000 a year. They're working class folks. They're concerned. Is their job going to be gone if there's a quote efficiency made? Are they going to be forced to do things in a new way that they're not used to after 10 or 20 years of doing it? And certainly, I think in the medical field, I imagine there's trepidation around both medical providers, MDs, as well as RNs, and all the others in between, the whole spectrum of healthcare providers of what does change mean? Who's going to lose a job? The system has worked for us so far, so I don't really want to change it if it's working for me. So I think a lot of times those are the questions, and we have to say, okay, change can happen over time. It doesn't mean it has to happen all at once. But I do think we all recognize that some change needs to happen. And that's everything from, how we provide the healthcare and the dollars to possibly even the discrepancy in remuneration that people get. Because, there's really struggling people in our society. And I think we're going to continue to have more troubles with this change that's happened, I would argue, since Reaganomics and trickle down, which is maybe another topic for another day. But income inequality, I think, drives a lot of these challenges.
So related to that, COVID-19 has impacted Vermonters in a number of ways. The ACA is under attack, and we have a new Supreme Court justice in the last 24 hours that the case will be argued in front of. Vermont has expanded its Medicaid rolls and in response to the ACA, and that's been fantastic, really, for all the hospitals in the state.
Absolutely.
And for our patients. But knowing what is at risk now, what policy changes would you advocate to ensure that Vermonters, people and their families, are not without health coverage in a time of need?
Yeah, I am distraught at the appointment that was just made. I think it was a complete injustice with respect to the institutional norms of how democracy is supposed to occur, how our system is supposed to work. As someone who's been in it for 22 years, I feel very fortunate in Vermont that we have not operated under such sort of bizarre changes. But I'll stop going off on that rant for a moment. Vermont has always been creative and innovative. Before the ACA, I think we were well above the national average at providing health insurance and health care for kids in particular. I think Howard Dean and Dr. Dinosaur, I think through the different VHAP and then, Catamount Health, and we just keep going. Sometimes it's new names, which is another political conversation for another day. Just renaming something or adjusting something and renaming it isn't always making the results you want. So I certainly would be looking towards, again, experts at how do we do it if we don't have the ACA? How do we maybe start? And this is something that's been a big part of my platform, is let's start with the universal primary care system. When we look at costs in our society and in our healthcare, I met with a couple of business owners back in, well, it was before COVID, it was January or February, who said they were starting to provide universal primary care for their employees. And we're seeing savings, a return on investment within 1 to 3 years, because their employees were getting their regular checkups. Their employees were going in to get looked at if they felt a little funny or something was off. And they were discovering, therefore, whether it was the beginnings of chronic illness or cancer or other ailments, much earlier in their stages of development. And we all know, I assume you all know, the earlier you find out about a particular chronic illness or a severe acute illness, usually the better the outcomes, usually the shorter period of time it takes to care for it. And both of those things mean lower costs. So these businesses were seeing that their insurance premiums were going down by providing no copay, universal primary care for their employees. You need to go in, period. And that cuts down on emergency room visits and others. So I really want to explore universal primary care as a foundation of how we get to a broader universal healthcare system.
Another question from our audience. Vermont has been held up as a model in terms of COVID management. What, if anything, would you do differently than Governor Scott with respect to the state's COVID response?
Well, as I'm sure some of you are aware, if you're on this side of the river, I am running to take that position maybe from the governor, but that doesn't mean we can't compliment where compliments are due. And I think the governor certainly deserves a great deal of respect for doing what I would hope any governor would do, which is listen to the medical experts, the science, and the statistics and the modeling. And so I've made it clear that I would keep Dr. Levine on as Commissioner of Health. I've talked to Mike Pichuk the other day, who's been doing a lot of the data modeling as well for the state and is really a cornerstone of those press conferences as well. And I would keep him on as well because I think it's a lot of people are concerned. What do you do about changing, captains in the middle of a storm? And I would keep the expertise right there at the table. And if you look at those press conferences, they're really the ones that do the majority of the talking because they're the ones that know that information better. The things I would do differently are sort of, it's always 2020 hindsight, but one thing was with the UI system, I would have put many more people into helping people get through the unemployment insurance system because we had a lot of people going through economic stress, which can often also lead to mental health issues and kids not getting the food or nutrients they need. So that was something that I was pushing hard on, and eventually the governor made some changes. This may come as a shock to people, but the governor for the last 4 years, we've had one face-to-face meeting. And certainly throughout my term as a governor, no matter who the lieutenant governor is, I would be including the lieutenant governor in far more meetings because part of the job of lieutenant governor is to be prepared to be governor were something to happen to the governor. And I offered to the governor in that second week in March to stand by him during those early press conferences. And his administration said, nope, we don't need you there. And frankly, throughout this whole COVID pandemic, I have asked to be included in medical updates and economic updates, and they have not done that. So one of the big things I would do differently would be to include the next person in line, because there's always the risk that any one of the three of us here or others could get sick and may or may not recover. And certainly part of the constitutional job of the governor and the lieutenant governor is the line of succession. So I would include the lieutenant governor, so that especially in a pandemic where you have to make decisions quickly, there's no 3 weeks to be brought up to speed, that I would include the lieutenant governor in those kinds of briefings.
I know on a lot of Vermonters' minds, myself included, and at our hospital in Windsor, we are concerned about COVID-19 vaccination. Whether this will be a federal or state approach, whether we will have a mandated vaccine. We kind of go through this every year with how we treat our flu shots, and we mandate flu shots for our employees in our hospital. What are your thoughts on vaccine distribution and whether it should be mandated or not?
Well, I appreciate the question. And for those that have been paying attention to Vermont politics, you may have heard other vaccine conversations. And I do want to take a moment to clarify some of that because my views on vaccines in general has, I believe, been quite distorted through the political process. I've always believed in the science of vaccines and support the use of vaccines. I'm vaccinated. My family is vaccinated. And I spoke a few years ago when the idea of the philosophical exemption for being in schools was talked about. And I joined with a third of the Senate at first voting against the amendment to remove that exemption because we didn't have really the full normal conversation around these things. But the reason for that was because there were families that had individual allergic reactions. There's no systemic issue in my mind problematic with vaccines. And they were sort of left out of the medical provided exemption, but they felt their child was at great risk because they had an extreme reaction. It would not have changed herd immunity. The point is, 11 of us voted to not remove that exemption. We lost that on the amendment vote, but then myself and the vast majority of those who voted against it then voted for the bill because the broader issue of herd immunity is critically important. So I want to make that point very clear in case anybody was not aware from the conversations this summer. With respect to a COVID vaccine, my understanding is it is a different form of vaccine. The main ones being investigated with respect to it being an RNA vaccine. And please correct me if I'm wrong, doctor. And my understanding is there haven't been RNA vaccines that have been mandated before. I could be wrong. Again, correct me if I'm wrong, doctor. And we're also going to have a limited number of the vaccines. So I appreciate the governor's work. I know they've got a panel that I believe is just about come out with their recommendations as to who should get it first. I think it's medical providers and potentially vulnerable Vermonters. And I think we need to go through the sequence of who has access to it. It should be universal access as far as price. There should be no barrier to it. But I would follow the medical advice. And what I've heard so far from Dr. Levine is not to recommend that it be mandated, but that we make sure it's widely available and recommended, highly recommended to those in those categories that it's most important to get. I will point out, I got my flu vaccine this fall. I often haven't gotten a flu vaccine, being on the younger side. Although at 49, I guess I can't say that as much anymore. But you know, again, at the advice of medical professionals, to make your jobs easier, to have fewer people coming in with COVID virus, that to help you and help all of our fellow other folks who might be vulnerable. I got the flu vaccine.
That's great. Thank you. I've been given the go ahead for one more question because we started a little late. My last question to you, Lieutenant Governor, is we have seen conversations around equity on the rise, both nationally and here in Vermont. We've also seen levels of divisiveness in Vermont that I don't recall seeing in my 20 years up here and my also 49 years in New Hampshire. What will you do as governor to advance equity in the state of Vermont?
Yeah, boy, we could talk about this for another half an hour. There's a number of things. Certainly, I was pleased when the legislature created the Office of Racial Equity at the cabinet level. That is a step in the right direction, but one person with no staff to do that for the whole state is a Sisyphean task. That's just not right. So in my administration, we would have a much more inclusive administration. I mentioned earlier, the governor has very much people that are in line with him, and he's talked about chemistry in that room. And for some people, they recognize that chemistry is also used sometimes as an exclusionary term for people who are different or have different views. And I think different views can be extended to maybe other differences. And I would make sure my administration is very inclusive so that as we make policy, we have people at the table with those different perspectives, different life experiences, different life traumatic experiences, so that we don't enshrine more elements of systemic racism in our system, but instead work to remove them from the system. We have to do this from our education system, where we have disproportionate detentions and suspensions at a 4-to-1 ratio, our incarceration system, our economic development system. You know, we're looking at multiple hundreds of years of systemic inequity. Wealth inequality is about 1/10 in the communities of color as it is for those of us who are not in the communities of color. So we have huge work to do from economic development to education to law enforcement to governance to be far, far more inclusive. And I've always operated that way, having voted whether it was for marriage equality when we passed civil unions, having supported cannabis reform since I first got to the legislature in 1997, which was part of the war on drugs that got expanded under Nixon to suppress the civil rights movement and suppress the peace movement. Many people don't recognize that things like our cannabis laws were related to civil rights in the 60s. So, and before that. So I have this deeply in my mindset to tackle head on.
Great. Any final thoughts, Lieutenant Governor, as you head down the home stretch toward next Tuesday?
Well, I appreciate the opportunity to speak with everyone. I would encourage people to reach out through my website, Zuckerman, FORVT.com, Zuckerman4Vermont.com. If you had another question that didn't get answered, you can send it to info@Zuckerman4VT.com. You can see a lot of my platform, including some conversation around vaccines and healthcare, economic development on the website. Just so happens that tonight at midnight is my close of my last campaign filing before the election. So if anybody wants to give today, I'm still trying to raise $3,200 by midnight. Again, thank you for the opportunity. Please, anytime you hear something that you think is either good or weird or bad about me, reach out and ask, because in politics, many, many rumors get spread, and you're welcome to come straight to the horse's mouth to get the clear picture. So thank you for the opportunity.
That was great. Thank you so much, Lieutenant Governor, and we'll call it at that. Thank you.
Joe, that was great.